Hello, my dear friends. I'm Dr. Vaishali Bharambe, Professor Anatomy. I'm the founder of the channel VP Anatomy Academy, where we teach anatomy with a purpose. What is the purpose? We are trying to build the foundation for your clinical excellence. Today, we are going to discuss Surgeon's Guide to Surface Anatomy, Abdomen Part 2. So this is a series of Part 1 and Part 2 in which I try to give you the surface anatomy of abdomen. This lecture series will place before you surface anatomy needed for various abdominal surgeries. You must be wondering, why surface anatomy? See, remember, what is surface anatomy? Why is it relevant? It gives you the outline of abdominal organs on the surface. How does it do that? Through visible landmarks and through palpable landmarks. Visible like bony prominences, sometimes like umbilicus, even the nipple, all these are visible landmarks. Palpable landmarks like bones, like muscles, cartilages, sometimes even arteries, pulsations are palpable landmarks. So using all this, we are going to plot the organ on the abdominal wall. Why do you want to plot it? Okay, how devious is that? What is this plot going on? So no, why are you plotting? Because it helps to connect your theoretical knowledge with your clinical practice. How? So see, you now know where the organ is. From you're looking at the surface and you know which is the organ lying beneath it. How does it help you? It helps you to better carry out physical examination. You are able to carry more safe surgical procedures, improving the safety and efficacy of your surgical procedures, and therefore better patient outcomes. And that's what we want. So that's why surface anatomy. You're going to be able to locate and reach an organ in a much better and precise manner. So this is Part 2. In Part 1, we've covered surface landmarks. We've covered planes of abdomen. Now I'm going to take you to Part 2, where we're going to individually plot organs, right? We will be talking about surface projections of major organs and blood vessels. This is the part that has already been covered in Part 1. Do please go and watch that. Right. So just a brief intro. How is abdomen divided into 9 regions? It's divided by 2 midclavicular planes and transpyloric and transtubercular plane into 9 quadrants, which are right and left hypochondrium in the middle epigastrium, right and left lumbar in the middle umbilical region, right and left iliac fossa in the middle hypogastrium. So these are the 9 quadrants. Of course, to add a little, in India we say tadka. To just add a little bit more to this, you have got a subcostal plane and you have got a supracristal plane as well. Okay, of course, if you need to know more about these, you have to go and watch my earlier lecture. Let's now begin to do some plotting. Surface anatomy of individual organs. Come. This is going to be fun. I have attached a PDF of abdominal wall to this lecture. Please download it, print it out, sit with a pen and paper, make 3-4 prints, okay, and draw as I teach you. You will find yourself understanding it in a fantastic manner, and you will have a better recall also. Do use the PDF, right? So points to keep in mind. Position of most abdominal viscera have some individual variations. They even have variations in the same person at different times, and posture and respiration have profound effect on position of organs. Like if you take a deep breath, your liver is going to go down. Okay, so simple things like respiration are going to make a difference in position of the organs. Right. So let's begin this with something familiar. Inguinal region and right iliac fossa, which is done even in your undergrad years. Deep inguinal ring. Relevant, isn't it? Okay. So, find the midpoint between the anterior superior iliac spine and the pubic symphysis. Okay. Now go 1.25 centimeter above it and draw a little oval. Okay. And that is your deep inguinal ring. What about superficial inguinal ring? So superficial inguinal ring, you find this the center of superficial inguinal ring, focus on this area, okay? 1 centimeter above and lateral to the pubic tubercle, here is the tip of the superficial inguinal ring. The base is 1.25 centimeter. The apex is 2.5 centimeters. It's a very tiny little space. That's your deep inguinal ring. That's your superficial inguinal ring. Okay. Now, how do you draw inguinal canal? Understand that if you draw two parallel lines joining these two, about 4 centimeter in length, okay, that's your inguinal canal. Do it again. Draw two parallel lines joining the deep inguinal ring to superficial inguinal ring, 4 centimeter in length, and that's your inguinal canal. Which is the artery you want in relation to it? Inferior epigastric artery. Draw it from the mid-inguinal point, passing upwards towards the umbilicus, dip to the inguinal canal, and that becomes your inferior epigastric artery. So let's talk about McBurney's point also. Just recall what is McBurney's point. Draw a line joining anterior superior iliac spine to the umbilicus. Plot a point at the junction of medial 2/3 and lateral 1/3. That point is the McBurney's point. What is its clinical significance? McBurney's point is the point of maximum tenderness in appendicitis. Is this where you find the appendix? Not at all. It's just a point where you get maximum tenderness in this patient. What about ileocecal junction? Draw the right vertical plane, draw the transtubercular plane. At the junction of the two, draw an oval, that is the ileocecal junction. To this now, you can draw a sac which is 6 centimeter long, inferiorly blind, superiorly open, that becomes your cecum. Okay, it almost extends down till the fold of the groin and go 2 centimeter below the ileocecal junction. You will come to the appendicular orifice. You can draw the appendicular orifice there, or at a 2 centimeter below the junction of the right vertical and the transtubercular plane, you will have the orifice of the appendix, right? So you covered quite a bit, quite fast. It's not at all difficult. Just keep on drawing it as I'm telling you. Let's now come to something that is a little difficult to draw. I'm going to show you an easy way, but yes, you will often read this kind of theory. Its bulky organ lies below the right costal margin, extending on to the left costal margin. Okay. In case of small kids, it's about 2 centimeter below, you can palpate it. Okay. In case of adults, you can palpate it 1 centimeter below the costal margin. In a person with strong abdominal wall, you can't palpate the liver at all. Right. This is all theory that's given. How do you draw it? Upper border, right border, lower border. So much theory. How do we do this? I'll show you how to do it. Come. So this is the image I've given you. This is the patient you have. Draw a point just below the right nipple. This is the liver you want to draw. Okay. Draw a point at the xiphisternal joint. Draw a point just below and medial to the left nipple. Draw your line slightly depressing downwards here. So that's your upper border. So how do you draw the lower border? Take a point 1 centimeter below the right costal margin at the lowermost point at the 10th rib. Go to the tip of the 9th costal cartilage. Take the point a little inwards, transpyloric plane, and then back upwards here. Okay. So what happened is when you draw this line, draw it dipping inwards here and then coming to the lowermost point. The right margin is drawn with a outward convexity like this, and there you have your liver. I have pushed it inside so that you get a better orientation of it, but the points will remain exactly what I told you. This is how we draw the liver. Okay. Now question is, how do I draw the gallbladder? Remember this little notch that we drew? This is where you can draw your gallbladder. Just edging, coming out of the inferior margin of the liver. That's where you will find your gallbladder. Next question is, what is Murphy's point? The point of junction between the right subcostal margin and the linea semilunaris at the tip of ninth costal cartilage is the Murphy's point. Right. How does all this knowledge help you to make that little incision for purpose of liver biopsy? So remember, when you learnt about the lung, the lower border of lung extended till the 8th rib. The lower border of liver extended till the 10th rib. Correct? So you've got the 8th intercostal space and the 9th intercostal space through which you can easily put your needle for collecting tissue for liver biopsy. Were you to go above the 8th, you would be puncturing the patient's lung, which you don't want to do. So thus your knowledge of surface anatomy helped you to carry out the procedure of liver biopsy. Right. Let's talk about some structures of the porta hepatis. First, the porta hepatis itself. Go 5 cm above the transpyloric plane, 2 cm to the right of median plane. Using this as the midpoint, draw a horizontal line 2.5 cm wide. That's your porta hepatis. Now from the porta hepatis, you can draw your bile duct, you can draw your portal vein. Come. So now I'm going to draw the bile duct as a structure coming from the midpoint of porta hepatis downwards and laterally with a rightwards turn, 7.5 cm long. That's my bile duct. What about portal vein? What do I already know about portal vein? I know my portal vein is formed at the level of transpyloric plane. So I will begin it at the transpyloric plane and carry it upwards to the porta hepatis. There I have my portal vein. Very simple. Link it all together. Let's come to inferior vena cava. That's a huge vein. Come. So remember one thing. There are 3 major openings in diaphragm. Okay, one at the level of T8, which is for the vena cava, one at the level of T10 for the esophagus, and T12 for the aorta. So for vena cava, I'm going to look at T8 level. At the upper end of IVC is going to be T8. Okay, come. So now this is what I have. The liver is drawn in dotted line for you to refer to. Go to a point slightly below the transtubercular plane, 2.5 cm to the right of median plane. Okay. Upper point is sternal end of the right 6th costal cartilage, which will be corresponding to around T8 vertebra. Now draw 2 lines 2.5 cm apart, joining these 2 points. And there you have your inferior vena cava. Very simple. Let's put our inferior vena cava in the right orientation for you. Okay, so that's the liver and your IVC is passing behind it. Okay, I hope you're enjoying this. I'm loving it. Friends, if you're liking this lecture, then do please like, share and subscribe to my channel. Remember, this is the only way I can understand if my lectures are really helping you. I will feel encouraged to make more of these videos. Please also share your comments in the comment section and of course your doubts as well. I'll revert back to you as soon as possible. Now, hit that bell icon and let's continue with the lecture. Right. So now if we've drawn IVC, we must draw aorta. So how do we draw aorta? Come. So upper point is 2.5 cm above the transpyloric plane, almost in the median plane, okay. Lower point is 1.2 cm below and to the left of umbilicus, or 2 cm to the left of midline at the supracristal plane. These are our 2 important points. Now let's join them by 2 lines which are about 2 cm apart. So you see your aorta is slightly to the left and your IVC is definitely to the right. Okay, draw them with that knowledge. And there you have your abdominal aorta. That's IVC. That's aorta. Put them in their right orientation all the time. Tell yourself you know their relation. You can't draw your aorta in front of liver. No. Right. So now let's begin to understand how to draw common iliacs, external iliacs. How do we draw these? Right? That's also relevant. So first, we draw the aorta, which we've already learned how to do. Now, from the lower end of aorta, you draw a line, mark the midpoint between anterior superior iliac spine and the pubic symphysis. Draw two lines with outward convexity, joining lower end of abdominal aorta to these 2 points. The upper 1/3 of this line is common iliac. Lower 2/3 is external iliac. You have to just imagine that at the junction of upper 1/3 and lower 2/3, two lines drawn going medially would be the internal iliac arteries. Right. So we'll now focus on drawing the three big blood vessels emerging from abdominal aorta: celiac trunk, superior mesenteric artery, inferior mesenteric artery. So let's talk about the celiac trunk, represented by a small circle in the median plane, 2.5 centimeter above the transpyloric plane. See, this is transpyloric, go 2.5 centimeter above it. It's a very short vessel. Remember, it's hardly 1.25 centimeter in length, which arises from front of abdominal aorta immediately below the aortic opening at the level of T12. Okay? What about superior mesenteric artery? Now, superior mesenteric artery, the upper point is represented by a small circle at the junction of median and transpyloric plane. Remember, superior mesenteric artery takes origin from the transpyloric plane. Lower point is at the junction of right lateral and transtubercular plane here. Draw your line with a slight convexity downwards, and there you have your superior mesenteric artery. Arising in front of aorta, 1 centimeter below celiac trunk at the lower border of L1 vertebra. That's your superior mesenteric artery. What about inferior mesenteric? Inferior mesenteric is drawn at a point 2 centimeter above the umbilicus and 1.2 centimeter to the left of median plane. Another point you will draw 4 centimeter below the umbilicus and join these points again with a line which is slightly convex. Okay, and so it arises from front of aorta, 4 centimeter above the bifurcation of aorta, opposite the L3 vertebra. At its origin, it is overlapped by the third part of duodenum. Please remember all this. Right. So let's revise quickly the ventral branches from aorta. That's the celiac trunk, that's the superior mesenteric artery, and that's your inferior mesenteric artery. Learn to draw them. Practice, practice, practice. You should not forget these simple blood vessels. Right. What surface landmark corresponds to celiac trunk and superior mesenteric artery? Celiac trunk, T12. Arises just after the aortic hiatus of diaphragm. Superior mesenteric artery, lower border of L1. Surface landmark, transpyloric plane. Okay. 1 centimeter below celiac trunk, posterior to the neck of pancreas. We know all this, but we need to revise it. Right. Let's talk about drawing the stomach now. So what is stomach? It has a cardiac orifice, there's a pyloric end, cardiac end, lesser curvature, greater curvature. Easy? Come, let's draw that. Cardiac orifice, upper point is on the left 7th costal cartilage, 2.5 centimeter above the median, 2.5 centimeter from the median plane. At which level? Left 7th costal cartilage. Mark this. What about draw two parallel lines here? That becomes your cardiac end. Next is pyloric end. So how will you draw the pyloric end? Pyloric end, you will draw the transpyloric plane. Put a point on this line, 1.2 centimeter to the right of median plane. Draw two parallel lines going slightly upwards and to the right, like this. Okay. So you got your cardiac end, you got your pyloric end. Cardiac end, pyloric end. Clear? Now join these superiorly to form the lesser curvature. Okay? But the greater curvature is difficult. Lesser is very easy. For greater curvature, you have to go marking a point in the left fifth intercostal space just below and medial to the left nipple. Second point is at the junction of tips of left 9th and 10th costal cartilages. And the lowermost point of the greater curvature will correspond to the subcostal plane. Got it? 1 point above, 1 point at the junction of 9th and 10th, and 1 point at the level of subcostal plane. Now join them. There you have your stomach. Let me put it in place now. It's gone inside. That's your stomach. So it takes some practice. It's not like it's all that easy. But yes, you have to practice it. It's not all that difficult either. Right. So if we have drawn the stomach, what do I already know? I already know how to draw the pyloric orifice. Therefore, drawing duodenum becomes much easier. Okay. We've drawn the pyloric orifice. Draw a line 7.5 centimeter vertically down towards the median to the right lateral plane. Horizontal part 10 centimeter at the level of L3 and 2.5 centimeter back up again. That becomes your duodenum. Let me put it back in place. So, you've drawn your stomach, you've drawn your duodenum. Okay. See, remember to correlate them. Now I have my duodenum. Therefore, what can I draw? I can easily draw my pancreas. Come, I'll show you. So, I have the duodenum. First part, second part, third part, fourth part. Inside this C, I have the head of pancreas. Sure. Only thing I don't have is the end of the tail of pancreas. So 2.5 centimeter above the transpyloric plane, 10 centimeter from the midline. If I plot a point, I join this. Here I have my pancreas. Okay, from the C of duodenum to the tip of the point we have marked. Put it back in place. That's my pancreas, right posteriorly placed. Right? Okay. So how do we draw the root of mesentery? Root of mesentery, for that you have to plot a point 2.5 centimeter to the left of median plane, 1 centimeter below the transpyloric plane, to a point at the junction of transtubercular and right lateral plane, and join these. There you have your root of mesentery. This is where the mesentery will be attached and then the rest of the small intestine will be suspended from it. So with this we come to very commonly asked plotting. That's for the kidneys. I'm going to plot kidneys from anteriorly and then turn the body over and show you how to plot the kidneys posteriorly as well. This is all the theory we have. Okay, let's plot it to understand. It's not difficult at all. Take a point 5 centimeter lateral to the midline on the transpyloric plane. That's the midline. I'm going to take 2 points 5 centimeter lateral to it. Right. Draw a line 2.5 centimeter long concavity medially, but on the right side it's going downwards. On the left side it's going upwards. Did you see that? On the right side it's going down. On the left side it's going up. Now you have to draw an upper pole of kidney and a lower pole of kidney. Upper pole of kidney 4 centimeter above the upper end of the curved line. On the right side here, on the left side higher. Lower pole 4 centimeter below but 7.5 centimeter from the median plane. Remember, your kidneys are not like this, they are like this, right? So the upper pole is much closer, the lower pole is much away from the midline. So these are the plots for the lower pole. Okay. Now mark a point 5 centimeter lateral to the first point here. Let's join this to form the kidneys. Right kidney, left kidney. Can you see how right is a little fatter but a little lower? The left is a little longer but slightly higher. These are your right and left kidneys. Let's put them back in place. There you have your kidneys. What is left then? Of course, the ureters. So, how do you mark the ureter? Mark the hilum of each kidney as shown. Take a point 5 centimeter below the transpyloric plane at the same distance lateral to the median plane. 5 centimeter below, 5 centimeter lateral. Mark a point on the pubic tubercle. Join the 3. Join the 3 on both the sides. There you have your ureters shown as drawn anteriorly. Okay. So now this is all we have drawn. We still have to add the renal arteries to it. I have an aorta already. So it's going to be very easy for me to draw the renal arteries, typically originating from abdominal aorta at the level of L1, L2 intervertebral disc, just below the superior mesenteric artery. See, I'm drawing the artery. See the position of the artery. It's very posteriorly placed on the right side as well as on the left side. Remember, right artery is slightly lower down than the left artery. These are my right and left renal arteries. So how do we locate the kidneys on the back? It's important since most of the time they are accessed from there. Okay, so let's draw them again from the back as well. Okay, so now I've given you this PDF as well. Use it. We are looking at the patient lying on his abdomen. Okay, these are the vertebrae. I have marked them from T11, L1, L11. It's all marked there. And that's the 12th, 11th, 10th and 9th rib. Okay, I hope you get that. Orient yourself first. Your patient is already turned. Draw two horizontal lines through the 11th thoracic and 3rd lumbar spines. Okay, this is left, this is right. Through the T11 and through the L3, two horizontal lines are drawn. Okay. Now I want vertical lines. Okay. So draw two vertical lines, 2.5 centimeter and 9.5 centimeter from the midline. Right. So what do you have? You actually have a parallelogram, which is called as the parallelogram of Morris. Asked. Okay. It's asked. Even though you have much better ways of plotting, parallelogram of Morris is asked very often in exams by your senior doctors. So do please prepare for this. Parallelogram of Morris. Inside this, we're going to fit our right and left kidney. So mark out the hilum of kidney 4 cm from the median plane opposite the lower border of first lumbar vertebra. Which plane am I talking about? Of course, the transpyloric plane. So 4 cm on either side is the transpyloric plane. Within the parallelogram, draw the outline of kidney so that the upper end is nearer to the median plane, lower end is away from it. Remember, the right kidney is going to be drawn lower down, the left is going to be drawn slightly higher up. That's up to your discretion, but remember that has to be done. From here, you have to now draw the ureters. There, you have your right and left kidneys. Happy? Okay, we are right there. We're almost finished with this class. Have patience. From that hilum, mark 2 points which are the posterior superior iliac spines. They're actually seen as two tiny dimples on the back of the patient. Join the hilum to the dimple and you have your right and left ureters. Okay, and there, fantastic. You have marked the kidneys on the and from anteriorly as well as from posteriorly. What is left? The spleen. So how do you mark the spleen? Take a point 4 cm to the left of median plane at the level of T10 spine. Take another point in the mid-axillary line on the left along the 10th rib. These 2 points are forming the axis of your spleen. Draw a point or a line joining the two, extending up till the 9th rib, down till the 11th rib. And there, that is your spleen. Line between the 9th, 10th, 11th ribs. 10th is the axis on the left side, extending down till the mid-axillary line. Let's color it. That's your spleen. Let's put it in place. Now I have given you this image for you to understand how it is from inside. See how it's running along the 9th, 10th and 11th ribs in this axis. Okay. So that's how you draw your spleen. Should we not discuss the spinal cord? Of course we should. The spinal cord extends down till the level of lower border of L1, surrounded by meninges which extend down, carrying the subarachnoid space till the level of S2 in this manner. So this space between the lower end of spinal cord and the S2 is your spinal cistern. It is here that you put in your needle for doing the lumbar puncture. So I want you to solve some MCQs. Come. So patient with right upper quadrant pain and positive Murphy's sign is suspected to have cholecystitis. Where is the fundus of gallbladder projected on the surface? I'm sure you know the answer is tip of right ninth costal cartilage. In a patient undergoing percutaneous renal biopsy, where would you mark the renal angle for the procedure? This I have not taught you. What is renal angle? Renal angle is the angle between the lateral border of erector spinae and the lower border of 12th rib. Is it here? Yes, between the 12th rib and the lateral border of erector spinae. This is where you mark your renal angle. Where would you locate McBurney's point to diagnose appendicitis? I'm not going to even bother to solve this. I'm sure you can. There's nothing easier than this. Right. The tip of ninth costal cartilage on the right side is a surface landmark for which organ? Stomach, spleen, gallbladder, appendix. Of course, the gallbladder. Spleen is best projected on the surface of which region of the abdomen? Left hypochondriac region. These are simple MCQs, but they're not supposed to challenge you. They're just supposed to make sure that you know your things and which organs are there in which space. That's all. So they're not supposed to be challenging. They're just trying to test whether your fundamentals are right or not. Transpyloric plane, a key surface anatomical reference, usually passes through which of the following structures? Iliac crest? No. Umbilicus? No. Tip of xiphoid process? No. L1 vertebral level? Yes. Lower border of L1. Right. So my dear students, if you like this video, do please like, share and subscribe to my channel. Remember to hit the bell icon. I hope you have seen the earlier video, which was Surface Anatomy of Abdomen Part 1. Both these lectures are specifically created to help you in your surgical precision to be able to mark out or plot organs on the surface of the abdomen before your surgery. So in the first lecture, we've covered all this. So we've covered surface landmarks, we've covered certain abdominal regions and the various planes, and the rest of the individual organs we covered in this lecture. I hope you enjoyed this lecture. I'll see you in my next one. Thank you. Bye.